If your blood pressure has been creeping up, you might think the answer is simply to exercise more, eat less salt, or completely change your diet. But lowering blood pressure can involve a lot more than just putting down the salt shaker. There are a few everyday changes that can make a real difference, and some of them are probably easier than you think. In this video, I will show you what they are, what the research actually says about them, and how you can start working them into your daily life. The first place to look is something you do every single day. What ends up on your plate? And this doesn't mean you suddenly have to eat bland food or follow some complicated diet plan. One of the most studied approaches for lowering blood pressure is called the DASH eating pattern. DASH stands for Dietary Approaches to Stop Hypertension. And the basic idea is surprisingly simple. Make vegetables, fruits, whole grains, beans, nuts, and other nutrient-rich foods a bigger part of your meals, while cutting back on foods high in sodium, added sugar, and saturated fat. What makes this interesting is that researchers didn't just come up with the idea because it sounded healthy. In a controlled clinical trial, people following the DASH eating pattern had substantially lower blood pressure than those following the comparison diet. Among participants with high blood pressure, systolic pressure was about 11 millimeters of mercury lower with the DASH type diet. And here's the part I don't want you to miss. You don't have to completely build your diet overnight. Start by looking at what is already on your plate. Could you add a serving of vegetables to one meal? Replace some refined grains with whole grains. Choose beans, fish, nuts, or other less processed options more often. And instead of thinking only about what you need to remove, think about what you can add that gives your body more potassium, magnesium, and fiber. The DASH diet naturally gives you plenty of these nutrients. The goal isn't perfection, it's gradually making your everyday meals more supportive of healthy blood pressure. But there's another part of your diet that can work against you, even when the food itself looks perfectly normal. And that is something we will get to next. You can improve the overall quality of your diet and still be taking in more sodium than your blood pressure needs. The problem is, most people don't get all of their sodium from the salt shaker. A lot of it can already be hiding in the foods they always eat. Things like packaged foods, processed meats, sauces, instant meals, breads, and other prepared foods. So, instead of asking yourself, did I add extra salt to this meal? The better question is, how much sodium was already in this food before it reached my plate? And you don't necessarily have to eliminate salt completely. The goal is to gradually reduce the amount of sodium you are getting from your overall diet. That's important because research from the DASH sodium study showed that reducing sodium lowered blood pressure, and the effect was even stronger when the lower sodium intake was combined with the DASH eating pattern. So one simple change is to start checking the sodium on the foods you buy, especially the foods you eat frequently. Compare similar products, choose lower sodium versions when they are available, and be particularly careful with foods that are heavily processed or packaged. And here is something else. Lowering blood pressure isn't only about what you eat. What you do with your body every day matters too. And once you start paying attention to what's on your plate, there's another change that can work together with it. Moving your body more consistently. You don't have to become a gym person, and you don't need to spend an hour doing intense workouts every day. Even something as simple as regular brisk walking can help. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic activity each week, spread throughout the week if possible. But here is where the research gets interesting. A large analysis published in 2023 looked at 270 randomized controlled trials involving more than 15,000 people and compare different types of exercise for their effects on blood pressure. Aerobic exercise, resistance training, combined training, HIIT, and isometric exercise all lowered blood pressure. But isometric exercise, where you contract your muscles without moving the joints, produced the largest average reduction in resting blood pressure in that analysis. That includes exercise such as wall squats and certain hand grip exercises. But that doesn't mean you have to stop walking and start doing wall squats every day. If you enjoy walking, keep walking. If you prefer cycling, swimming, dancing, or strength training, those can still be valuable ways to stay active. The bigger lesson is consistency. Find a form of movement you can actually maintain and gradually build up your activity rather than trying to go from almost no exercise to an intense workout overnight. Because there's another factor that can quietly push your blood pressure in the wrong direction, and it has less to do with how much you exercise and more to do with what's happening to your body weight. But here's another piece of the puzzle that people sometimes overlook: your body weight. If you are carrying excess weight, even losing some of it can help bring your blood pressure down. And you don't have to reach some perfect number on the scale before your blood pressure can benefit. Research has consistently found that weight reduction is associated with lower blood pressure, and the effect tends to become greater as more weight is lost. But here is where I want you to think about this differently. Don't make losing weight your only goal. Make your goal to build habits that make a healthier weight easier to maintain. These changes we've talked about, eating more whole foods, reducing sodium, and staying active, can all work together here. So, instead of trying another extreme diet for 2 weeks and then giving up, focus on changes you can actually live with. Eat smaller portions when needed. Make more time to move throughout the week. More filling nutrient-rich foods. Eat less processed food. And give your body time to respond. Because lowering your blood pressure is not about finding one perfect trick. It's about stacking several small decisions that work in the same direction. And there is one more daily behavior we need to talk about, especially if you drink alcohol, because it can quietly work against all the other changes you are making. You might think a drink helps you relax, but alcohol can push your blood pressure upward, especially when you are drinking more heavily or more often. That is one reason current blood pressure guidance recommends limiting alcohol rather than treating it as harmless for your heart. For people who drink, the 2025 American Heart Association and American College of Cardiology guideline recommends no more than 2 drinks a day for men and 1 drink a day for women. And if you currently drink more than that, you don't really need to think about it in terms of, I have to change everything tomorrow. Start by paying attention to how often you are drinking and how much you are actually having. Cutting back can be one more piece of the puzzle, and when you combine it with the changes we've talked about, you are no longer relying on one single trick to lower your blood pressure. Because that's a really bigger problem here. Lowering your blood pressure naturally isn't about finding one miracle food, exercise, or one secret trick that suddenly fixes everything. It's about stacking several ordinary choices in the same direction, improving the quality of your meals, paying attention to sodium, staying physically active, working toward a healthier weight if you need to, and being mindful of alcohol. You don't have to change everything overnight. Pick one change you can actually start this week, make it consistent, and then build from there. If you find practical, research-based heart health information like this useful, consider subscribing. But there's another number you shouldn't ignore if you are serious about protecting your heart. Your blood pressure is only one part of your cardiovascular risk. Your cholesterol levels matter too. And the recommendations for managing cholesterol have recently changed. A new cholesterol guidelines has introduced some important changes in how doctors assess cardiovascular risks. which cholesterol numbers they pay attention to, and who may actually benefit from treatment. I've put that video right here. So if you want to understand what these changes mean and what you should know about your cholesterol, watch that next.